writing utensils? Yeah, most people have stuff. Okay. All right, great. Okay, so welcome. My name is Amanda. I am the Center Director at Brain Balance of San Diego, and my co-presenter is?
I'm Dr. Kevin. I'm a pediatric and family chiropractor here at Artsy. I'm an independent business inside the center, and I also have another office in Mission Valley also.
And today we are all here to learn more about neurodevelopmental disorders and kind of just getting to the root cause of what's happening, what you're seeing, or maybe you're trying to figure out what is happening too. And so our two professions we'll talk more about go really hand in hand in understanding brain development and connectivity and how that information flows through the rest of the body and how it can be impacted. Okay?
All right. So like I said, my name is Dr. Kevin. I'm a pediatric and family chiropractor. And I'm also have a focus on taking care of the nervous system in individuals that have autism and epilepsy. Before tonight, how many actually realize chiropractors work with kids? Okay. Yeah,
Babies.
Yeah, babies too. We don't usually get that too often where people realize chiropractors work with kids. And the reason why, because who remembers the Yellow Pages? Yeah. So back in the 70s, they had a guy hunched over with lightning bolts coming out of his back saying, "We can help your back pain." So chiropractic is so much more than that. We're going to dive a lot more into that in a little bit. And I'm also what's considered a Focus Academy doctor, where I actually took extensive training when I finished chiropractic college and did a lot of actually what brain balance does. I learned all about the brain development and different trajectories it's supposed to go on and look to see where there's are possible limitations where the brain didn't fully develop and how we can help exercise more to make that grow. And Amanda's going to talk a lot more about that because that's her expertise. And then, how many of you have the belief that we're designed to be healthy and not sick?
Oh, yes.
Yeah, absolutely, right? We have that same belief, and it's actually called salutogenesis. Saluto meaning Latin for health, and genesis, creation of. So looking more of like what's right with an individual and not focusing on a disease.
Yeah, and brain balance is the same idea. The goal is for every individual to reach their potential, but we know that there's things that may be preventing that. And so my background in particular is in education. I've been in education for over 10 years, and when brain balance came along, and it came along to San Diego, I should say, it's been around for over 10 years, and we've served over 45,000 families. I was like, yes, I wanted to be on board because I knew being in education, formally and informally, in many different respects, working with school districts to families and everything in between, honestly, there just wasn't enough. I could tell there wasn't enough happening, and parents were always asking what was happening too, and the interventions in school aren't always appropriate. And so, again, when Brain Balance came along, I was like, yeah, I want to know more, and I want to share this with the community. And my number one goal with Brain Balance is to be a community resource, and that's why we're doing these presentations. It's not always about, come to us, I want you to know knowledge is power, and this presentation, I hope tonight you walk away with a lot of information that you can now make better decisions on, and not just what your physician says or what really the medical community. I know Kevin's medical, I'm non-medical, by the way, but oftentimes it is just, here's medication, and Dr. Kevin and I are saying, there's a better way, and let's get to the root of it and not just put a band-aid on what's happening. So my background's in education. I'm also a certified, internationally board certified cognitive coach. So I've done extensive training as well to learn more about these neurodevelopmental disorders and how we can support families and individuals who are at our center. So today we'll go over what are some potential developmental delays, what's going on with the brain and how it develops, and how subluxation, we'll define that later, and how that affects your development, and then what are things you can do, right? It's not just here's information and good luck, it's what can you do about it now, come on in, and then how can we, in our own practices, help support you as well. So welcome, I'm Amanda. Oh, hey, that's one of my parents too. Okay, so who do we work with? We both work with a lot of different types of children. So whether or not they have a diagnosis or not, and oftentimes, maybe not oftentimes, but it's not uncommon if a child comes to us with a diagnosis, it's probably wrong, because some things like ADHD, dyslexia, autism, that doesn't just go away. The challenges associated with it can be more resolved, and it can be much more manageable, but whatever they were diagnosed with doesn't just go away. You can just find ways to manage it better, right? So again, it really doesn't matter, but we work with kids who have issues with ADHD or attention and focus, learning disorders for sure, like dyslexia, different processing disorders. A lot of parents don't know what processing disorders are, or sensory processing disorders are. Maybe ASD, defiance, ODD, operational defiant disorder. We see a lot of that as well. and how it comes across can affect academics, social interactions, whether it's appropriate or inappropriate, how their behavior, acting out, maybe they're just saying mean things, they're not a mean person, they're not mean-spirited, but it's coming out, right? So there's that impulse control as well. Family and social relationships. It really breaks my heart when, again, not uncommon, when I ask families, when was the last time you had a good day? They can't answer that, unfortunately. And so we work through that, right? What is going on? And then those emotional outbursts like we talked about, and immaturities overall. And generally, if you're here and there's true neurodevelopmental disorders, they're gonna be immature in a variety of ways. Okay? So let's understand a little bit more about what's going on.
And I believe you guys all have the answers of what it takes. Who all drove here tonight? Yeah. So what does this mechanical system need to operate? What do we need? Gas, so we need our power, we need our fuel. Engine, so we need our parts.
Actual person driving.
Man, nailed
No one
it.
ever says that.
Yeah, exactly. And that has actually come to my longer talk. So I shortened my presentation to make it more or not as time consuming for all of you tonight, or else we'd be here till 10 o'clock. So I shortened it, but yes, as Amanda stated, no one ever gets that. We need that information. So we need the parts and the power, and we need, most importantly, that information. And how about these computer systems? We all have our phones, we all have tablets, we all have computers. What do those systems need to work? Yeah, same things, absolutely. Parts, power, information. And how about these amazing living systems you all brought here today, your human bodies? Same thing, absolutely. I don't want to make it difficult, because when we make it difficult, we go into stress, and I don't want to stress you out, okay? So we need our parts, power, and information. Same exact thing. And then we have lots of parts. We have our arms, we have our feet, we have our ears, we have our nose, we have our mouth, we have all these different parts. We have all these specialist doctors who work in all those parts. And we need all of them because does the body work as a whole, or does it work independently of itself? Works together, right? And we're going to talk about that in a little bit. And we have the power. What's the power to the human body? What do you guys think?
Food?
Yeah,
Yes.
our food, our water, absolutely. We need all of those things, and this is actually a lot more in demand from the public because the public wants more of this. They want the functional nutritionists, they want the holistic practitioners, they want more to support their bodies. And then how about information? Who checks the parts of power that go to and from the body? Who do you think these information doctors are?
Didn't know you were going to be quizzed tonight,
I put you on the spot. Who are the information doctors?
The information?
Yeah.
Psychiatry?
Close. They work with the brain, right?
Yeah.
Information doctors, it's my specialty. That's where I step in. I look at the quality of that information getting to and from the brain. And we're going to talk about that nervous system here in a little bit. And since systems are made of parts, they're all eventually designed to break down. What speeds up that breakdown process?
Sleep.
That would help it.
Lack of sleep breaks it
Yeah.
down.
It's another S word. A lot of people are experiencing this a lot. Stress, yeah. Stress speeds up the breakdown process. What happens if you take away the parts, power, and information from this plant? What's going to happen to it? Maybe pollute the soil, don't give it water, don't give it light. What's going to happen? It's going to die. It's going to start to break down, right? Same thing happens for the human body. And kids nowadays are 30% less active than previous generations. Why is that?
Technology.
Yeah. And Amanda's going to touch on that in a little bit when talking about limiting screen time and how it can actually affect the brain. And then once we start to experience symptoms, do we think they're a good thing or a bad thing?
It's a good thing.
Yeah, absolutely.
That's how you look at it, right?
Yeah,
Yeah.
because it's a perfect expression of something's wrong in your body, and your body's saying, hey, check me out, let's go. We don't like symptoms because they don't feel good. And we live in a cause and effect world.
So tell me, if you don't mind, go ahead and kind of popcorn it out. What are some challenges and those symptoms we're talking about that you see with your own child?
Poor concentration.
Poor concentration, very common. What else?
Academic avoidance.
Task avoidance, academic avoidance.
think the social cues are really, the immaturity with the socialization is, I think,
Mhm.
really difficult right now.
Whether they are playing by themselves only or can't play by themselves, I see both ends. They only want to play with older, or they only want to play with younger, right? It's not with their peers. Anything else?
Don't know how to act around other people because they're not used to, they don't have friends, or not used to being around
Yeah, so there's-
people their own age group, so to speak. you know.
Yeah, and there's that too, right? There's the extremes, but then like that social awkwardness, right? Like, I don't even know how to interact with others. Maybe because they don't understand how to interact with their own bodies and feel their own bodies, right?
I think sometimes like the sensory aspect I see a lot too, where it's just like overstimulating and can be overwhelming. So that's when their like brain isn't able to process
Yeah.
it, and it just like shuts down.
Yeah,
and then you
so
start to see all those other things.
I'm glad you said that. Sensory overload is very common, especially kids with neurodevelopmental disorders. I'm actually going to do a talk about that in a couple weeks on November 18th, as well as in December, and I think in your goodie bags I have a flyer about that. But the holidays right now, starts with
Yes.
Halloween, honestly.
Yes.
It's exponential from there, the sensory overload.
Yeah.
So we can talk more about that if you want to know more at the end. But yeah, so a lot of these challenges that you threw out, these symptoms that you're seeing, they're just the tip of the iceberg though, right? And oftentimes other interventions will look at, okay, you have a hard time focusing, let's train them to focus. If it's hard time making friends, let's put them in a social situation and train them to make friends. But that's just putting a Band-Aid on the issue. There is so much more going on underneath the surface that may be the cause of that, right? And that's kind of basically our presentation tonight is, what is happening? What's causing them to not be able to focus? What's causing them to not be able to socialize correctly? Why are they having task avoidance? It's not just because they're not motivated or they're lazy. What is going on? And really you need to understand the whole child and the whole person, not just child, to really get to the root of it. And some examples here is looking at cognition, right? Looking at how well things are functioning. Is all your different types of memory in working order? Are your processing skills in working order? Looking at fine and gross motor skills, body awareness I talked about earlier when it comes to socialization or emotional control is, can they even feel their own bodies? Literally, sometimes, can you feel your own body? We have kids who are not potty trained that are teenagers who still wet the bed. Something is disconnected, literally disconnected to prevent that from bringing that child awareness that they have to go, right? I talked about sensory processing and even something as basic as primitive reflexes. Has anyone heard of that before? Maybe you, because you, yeah. So she's
I feel
a
like
early
I-
childhood educator, right? Yeah, of course. So primitive reflexes are something really nobody ever talks about, and it's okay in a sense only because generally you don't have to talk about it. It's something kids are born with in infancy for survival, but by about toddler years, most of them should be inhibited. They never go away. The reflexes never go away, but they inhibit to allow for normal development. And when it's retained, it can affect your motor skills because it literally means you don't have full control of your own body, and it can affect learning. And so brain balance in particular looks at different reflexes. I know Dr. Kevin talks about that as well. So there's so much more to the picture. And here is an example of brain balance's developmental pyramid that we kind of base our program around. And we talked about the whole child. You have to look at all the pieces of the puzzles, from these different reflexes to your various sensory motor skills, because again, well, maybe I didn't say it, I was practicing, but what triggers your brain and all those neurons and connectivity, primarily, or the strongest connectors are your different senses, all 5 of them, as well as movement. That's why movement is so important for a child and in development. So we look at all those pieces: body awareness, processing skills with auditory and visual, cognition skills, and really, how's your rhythm and timing? Another aspect that a lot of people don't look at. But if your body's not processing and in sync with the information in the world around you, you're either too fast or delayed. I mean, you're not optimizing at your best and your full potential, right? So we look at the whole child, and you can see to the right there how those different aspects might affect their everyday lives.
So as they work with the pyramid, we actually look at the quadrangle. So we're going to look at the neurodevelopmental quadrangle that was developed by Dr. Paul Hardy. So in the center, he puts the genetics in the center. So there were 2 studies done, one by the University of Stanford, one done by the University of Norway. And because there was a belief before that there was never a real rise in autism, that they were just like, oh, it's better diagnosis, it's genetics, it's more diagnostic grouping. But those 2 studies actually looked at that, and they saw that 50% of that 1,000% increase, because back in the 1970s it was 1 in 10,000, and now in 2014 was 1 in 50 kids were diagnosed with autism. So they looked at this huge increase, and they actually found that 50% of it was attributed to genetics, diagnostic grouping, and earlier diagnosis. What do you think that other 50% of that 1,000% increase was attributed to?
Environmental factors.
Man.
Sorry,
Yeah.
I just have to
Nailed
talk.
it.
I'm just
So this morning, not this morning, this afternoon, I was just on a really interesting talk. So San Diego State University, so San Diego in general, if your child is struggling with autism or you know someone struggling with autism, San Diego is one of the main places to be. There's a lot of great research happening. And so San Diego State University has an autism center, and they just had a really informative talk noting how 1 in 54 kids, this is the latest data, 1 in 54 kids have autism, some level. And then what's going on, like Dr. Kevin said, what is happening, genetics, environmental factors, and then what are these evidence-based programs that can help. And so all that has been researched and studied. So they just did a really interesting talk on that, and if you're interested in learning more, just check in with San Diego State University. But hopefully I get the slides. They said they were going to send me the slides. So I encourage you to look into it more, share that with someone else if you want to learn more. Yeah.
So Dr. Paul Hardy did put the genetics in the center because they are important. Because if someone has a hard time detoxing and their body's struggling with all these things, of course we're going to have different challenges. So we have the 4 major systems of the body: the nervous system, the immune system, the detoxification system, and the GI system. Why do you think the nervous system's at the top?
First, are you guys familiar with the nervous system? Let's gonna break it down.
We're going to get into that one. That's the video.
Yeah, but they don't know. They can't answer that question.
So the nervous system is made up of our brain and our spinal cord. It controls everything in our body. It controls all the parts in our organs, and it controls every function of the body too. And there's 2 parts to it. There's the sympathetic there is the autonomic nervous system, which has 2 parts to it. So autonomic, simple word, automatic. It's what our body does without us thinking about it. Because are we sitting here worrying about our heart rate? Are we worrying about breathing or blinking? We don't look at those, we don't think about those things, it just happens automatically. So our nervous system, when it's stressed, our nervous system starts to break down. And it controls all these other systems in our body. That's why it's at the top, because it coordinates everything else. So now let's say we have this person in this very toxic environment where they have possible malnutrition, multiple toxins in the body, and then we're going to take them through their individual genetics and the individual health of these 4 major systems. We're going to start to get different symptoms. Once we start to get different symptoms, we get different labels for different neurodevelopmental disorders. And oftentimes, as Amanda said, we're told, take this medication, this is all we can do, manage the behavior.
Right.
Good luck.
Or too bad, so sad, right? You get
Yes.
a diagnosis and there's nothing we can do.
But what if we start taking care of all these systems, improve the health of the nervous system, improve the health of the immune system, the detoxification system, the GI system, maybe improve our environment, get rid of some toxins, better food, get better nutrition into the body? What's going to happen to the overall health of that individual? It's going to go up, right? It's the only way it can go at that point.
So essentially what we want is a balanced system, like you said, but it starts with the brain, right? You need a balanced brain. You need all those areas to be working in concert and developing appropriately. And this is an example of what it looked like to be left brain and right brain strong. So in a very simple sense, right, left brain, right brain control different areas, but more importantly, it's the connections. And we're going to talk more about the connections between the region. But when you have a balanced brain, you have an individual functioning at generally their potential, and they're not struggling like someone else might, right? And so when you get an imbalance, that's when you see some of those symptoms we talked about, those challenges that you might be seeing in your own child and in the community. So there are certain kids where you pass by them, you're like, yeah, something's going on, right? And so that's not something you're stuck with, though. We know there's reasons behind it, and the goal between our practices, at least, is to figure out what is happening, what can we do about it, and how do we rebalance that brain. And so the next slide will show, in a very general sense, what it looks like when you're left brain weak versus left brain weak. Now, this doesn't mean that if a child is deemed right brain weak, for instance, and by the way, majority of kids with the struggle, neurodevelopmental disorders, they tend to be right brain weak. That's just the data out there. But it doesn't mean that they don't have any strengths in the right brain, and it doesn't mean they don't have any weaknesses in the left brain. But it's important to know what's happening and look at early indicators from missed milestones. That's a big one. The retained primitive reflexes, issues that you might have been seeing since they were young. And once you understand where their weaknesses are, you can work on those weaknesses, and we'll talk more about that later on. Does that make sense for everyone? Okay. So we talked about connectivity. So yes, the regions of your brain need to be strong, and they're responsible for different parts of development and functioning, but there's a lot of great data. Even this year it come out, Cambridge Urban University just came out to continue to confirm it's the connections between the brain regions that's so closely aligned with the challenges that you're seeing. So not only do you want to improve the weaker areas of your brain, but when you do that, you improve the connections between the different hemispheres. The way it
See,
happens.
stress response.
I know,
Doing the stress response.
So I like to think of the brain like a highway. Everything should be flowing smoothly, and when you're on the road, happy-go-lucky, right? Nobody's bothering you, you're flowing, you get to where you need to be. But with the challenges that your kids are experiencing, it could be more like they're driving on the highway and then they, take the wrong turn, or their GPS sends them the wrong way, or they hit a dead end, or there's construction, or there's a delay. There's a lot of these disconnections in the brain that might be happening that affects your child in different ways. And so again, once we know what's happening, we can improve those connections. At Brain Balance, with a separate study, so not the first sentence there, but in a separate study that we're working with them on, or have worked on, we have shown how working on the brain and through the different exercises and intentional activities really that we're working with them on has improved a statistically improvement in 11 of the 12 cognitive tasks. And that's important because cognitive skills affect executive functioning, which affects the behaviors that you're struggling with. Okay? So
Now we're going to touch into that nervous system. So our nervous system, like I said, is composed of our brain and our spinal cord. And that's actually connected. The spinal cord transition to the brain is actually inside the brain stem. And then the nervous system is actually encased or is surrounded by meninges, which kind of act like a balloon. And what it does, it houses cerebral spinal fluid, which, easy way to put it, gives nutrients to the nervous system and takes away toxins. And this entire system is encased in bone. It's the only system in the body that's actually encased fully in bone. Why do you think it's encased in bone? Yeah, because it's important, right? And the role of the nervous system, it acts like a sponge. At any given second, it's taking in over 11 trillion bits of information. Now imagine if I was standing here, scratching this wall, nails on a chalkboard, you're hearing the humidifiers, maybe the light's twitching, maybe these nice comfy chairs are not so comfy. We're not thinking about those things, but a lot of times with kids who have neurodevelopmental disorders or sensory processing disorders are having struggles with that, where they're hearing all this rattle in the back of their head and in their brain, and they can't focus, and they're told, oh, sit here, look at this computer screen. Oh, read this book. How hard it would be to do those things if you have all this other background noise and you can't tune it out. Whereas a lot of adults actually experience the same thing too, where they can't tune out that noise either. So I know Amanda's team also works with adults. They don't just work with kids, they work with a whole variety of individuals, as I do in my office. And then we're gonna have this nervous system, like I said, we have made up of the spinal cord, and we have nerves that come out of the spinal column. All those nerves go to every body part in our organ. So there's this very fancy word that's called a subluxation. Who's ever heard of that word before? Yeah. Do you know what it is?
I know more for ortho.
Yeah.
Where you subluxate your shoulder, it's dislocated.
Yeah. So subluxation is less than a dislocation. Another easy way to put it is the vertebral body or misalignment of the spinal column, which causes nerve interference. So a bone is out of place, causing nerve interference. We're going to talk about this very fancy word disafferentation in a little bit. And then, remember we talked about that fight or flight response? When we go into that stress mode, when the phone rings, or someone else is giving a presentation, we go into that stress response. We go into a fight or flight stress response. Because if there's a tiger sitting in the corner of this room, what's going to happen to your guys' heart rates? Yeah, are we going to start sweating? Do you think our lungs are going to open up so we can take in more air? Our pupils are going to dilate so we can take in more of our environment? But as soon as that tiger's gone, what should our body do? Yeah, it should calm down, right? But a lot of times, kids don't, or not just kids, individuals don't go into that resting, healing, digesting, parasympathetic response. I'm going to throw out the big word there because I like them. So, huh?
That's me.
Yeah,
Right,
you're always
yeah.
heightened, right? You feel always heightened, right? Kids
Yeah.
and adults.
And a lot of times, individuals don't come out of that response once they go into that stress response, and their body starts to break down. And then, neck adjustments have shown to have a parasympathetic effect on the body. So that's that resting, healing, digesting response. And now I want you guys to take a look at this picture, okay? This is a child, this is actually my boss's son. So I want you to take a look and tell me what you see on his body other than the beautiful artwork.
His shoulder blades are out of line.
Yeah? What else?
His spine.
Curve.
See curve.
Yep.
Yeah. So I'm gonna throw these lines on here, okay? We're gonna look at it even closer. Look at his earlobe
Yep.
heights.
Oh yeah. Oh wow.
One's so much higher than the other one, right?
Yes.
Oh.
How about you point out the shoulders?
Yep.
So this shoulder's higher, or this shoulder's higher than the other one.
Yeah.
We saw the winging of that scapula, where it's completely rotated. See this yellow line here? That's where his spine's supposed to be.
So you saw that.
Yeah.
This is where his spine's at.
Wow.
You see his pelvis? How much it's rotated?
Yeah.
This is a physical representation of what a stressed nervous system looks like.
Oh.
Extreme though.
Yeah, very extreme. So my boss's son has a condition called, almost said Rett's, it's not it, pandas. Who's ever
Oh,
heard
yeah.
of pandas?
Yes.
Yeah. Pediatric, autoimmune, neuropsychiatric disorder associated with streptococcus. It's a mouthful, but a lot of it actually represents a lot of bipolar. It represents a lot of autism. So it's actually a little bit newer in the diagnosis world, or they didn't really know a lot about it. Yeah.
What was the last word you said?
Streptococcus.
Streptococcus.
Like the infection?
Yep.
The bacterial?
Yep.
Yeah.
Yes.
The
So
bacterial infection?
yeah, that causes all this brain inflammation. And we're actually going to talk about brain inflammation in a little bit and how it can lead to a lot of these different challenges. So during this time, my boss is a chiropractor. He was not able to check his son for subluxation. These little dots here are where those subluxations were found on his son's body. Could you imagine your entire life purpose is to help people with these challenges and you can't even adjust your own son? It was debilitating for him. And then we're going to talk about a few diets in a little bit. His son was craving bean and cheese burritos all the time. Because what do a lot of the kids crave? Pizza, carbs, absolutely, right? They crave all those things, but I'm going to tell you it's not them that's craving it,
Yep.
it's something else, and we're going to talk about that in a little bit.
Interesting.
And then now subluxation and autonomic imbalance, or autonomic balance. So remember we talked about that fight or flight response and the resting, healing, digesting response? So we have those two sides that should be balanced. And in my office, we use what's called heart rate variability, where it determines how well that nervous system is balanced. And there's over 33,000 peer-reviewed articles on HRV. And what we do those on these assessments to see where that nervous system is balanced, whether we're in that response or in that parasympathetic response. And then chiropractic, remember I told you it's so much more than the neck pain and back pain? This is a perfect example. So this is Chris. Chris came into our office with a diagnosis of cerebral palsy. And when he was actually brought in, he was carried into the office because he couldn't walk. He was moaning and groaning all the time because he had so much stomach pain. And he was just not full of life. So this is actually 2 months after Chris started care. So I just want you to notice his gait, notice his head control,
Good job, buddy. Good job.
and even listen to what mom says.
Doing it, bud. Look at you go. Good job.
I can feel his legs
Yeah.
strong,
Yeah.
and his steps are.
His head, his head position's getting so much better. It's
Yeah,
stable.
yeah. And now
Good
he's happy. He's
job.
working. In the beginning, just started to cry or getting tired.
Yeah.
So now,
Very good.
What'd you hear mom say? I know it's a little hard to hear, probably in the back too, right? So she said that she feels his legs moving more. He's happy when he's walking, where before they try and make him walk, he was always upset.
Right.
So this is another few months after Chris came to the office. Now I want you to notice where mom's standing now, okay? I want you to notice what's on his face too.
Hey, Chris.
What's on his face?
Such a big smile.
Look
No
at that,
glasses.
buddy. You're doing amazing.
Yeah, no
Smile.
glasses. Who pointed out no glasses?
Yay.
He looks happy.
Yeah, he's happy, right?
He's walking.
Yeah, and he's walking and he doesn't have glasses anymore. It wasn't that his eyes were bad, his
Wow.
brain was just that disconnected from his
Wow.
body, he couldn't see straight. So once we started to remove that interference from his body started to heal itself. Because remember we talked about that very fancy word, salutogenesis?
Yeah.
This is exactly what's happening with Chris's body. And then we're also going to look at more talking about the brain, because we're working with the brain all the time, right? So after an adjustment, it actually showed how brain activity increased by 20%. So another way to put it, this study looked at glucose in the body and the brain. So after an adjustment, the body was more efficient in doing the same activity. So it required less energy to do the same thing. And now what causes these subluxations? What do you guys think? It's that big S word.
Stress.
Stress. Yeah. We have stress. Then we have physical, chemical, and mental stresses. And how do we get all these things? Well, physical stress obviously makes sense, right? We fell down a flight of stairs, that can cause a lot of things. And then what about chemical stresses? The food that we're taking in all the time. And then mental stresses. Have you ever heard of have you ever heard of that thought where they say if you think you're sick over and over and over, you're gonna get what? Yeah. So if we have all these negative thoughts all the time, that can lead to these subluxations also. And then talking about birth trauma. So sometimes it can actually start at birth. My goal as a chiropractor, well, I skipped ahead 1 second. So in this study here, they looked at 1,000 infants that were checked in the first month of life. 80% of them were found to have a vertebral misalignment of their upper neck. And not saying all babies have this, just some do. And then this doctor here said the birth process, even under optimal controlled conditions, is potentially a traumatic, crippling event for the fetus. Spinal cord and brainstem injuries often occur during the process of birth, but frequently escape diagnosis. Why is escape diagnosis? No one's looking for these things. No one's checking. The only time an individual gets checked, there was another study that was up here that looked at 1,250 infants, and they found that 90% of them had suffered severe neck and cranium. 90% suffered severe trauma to their upper neck. And then 10% of those were actually considered more severe, and we say that some of those 10% are lucky. Why do you think that is? So we say some of those 10% are lucky.
Because they get addressed.
Yeah, because they usually show up like this, right?
Right.
If your baby comes out like this, you know something's wrong. So they take a look at it. But oftentimes, babies aren't checked. So my goal as a chiropractor is one day that every baby is checked at birth. Just checked. They may not need an adjustment that day, but just to be checked
Right.
from that point on for the rest of their life. Because why should we have these nasty subluxations in our body? Remember we talked about the neurodevelopmental quadrangle? Now we're going to actually branch off into the neurodevelopmental disorder trifecta. So remember we talked about the genetics in the beginning, how they are important? So individuals who have neurodevelopmental disorders already have a predisposition to having a decreased microbiome. Who's heard of the microbiome before? Yeah, do you know what it is?
It's in your gut. It's the flora, all that stuff. The
Good stuff.
prebiotic, probiotic stuff. Yeah.
Man, you want to come and finish this class?
No, I
You're
don't.
doing amazing.
No.
Yeah, so it's the buildup of our good and bad bacteria. So these kids are already predisposed to having that decreased microbiome, and we're going to talk about other triggers that could possibly lead to that. We have C-section. Why would a C-section possibly lead to a decreased microbiome? What do you think? There's no wrong answers, I promise. They don't go through the mother's vaginal canal.
Okay, that's what I was wondering.
Yeah, it's okay to say. We're all adults here.
It doesn't happen here. They just get
So they don't go through that mother's vaginal canal, and they're not getting exposed to the mother's microbiome. And there's studies out there that actually doctors are now swabbing the mother's vaginal canal and placing a toothpick or a Q-tip into the baby's mouth so they get exposed to that microbiome. It's a good thing and a bad thing, because there's other studies showing that if a mother has a bad microbiome, they're now passing that bad microbiome onto the baby. So you think we need to take care of the moms too? I do. Antibiotics, why would that decrease the microbiome?
You don't have Right, you don't have your system creating that
Healthfully
healthy.
killing.
Yeah.
Right.
Kills it
It's the
off.
opposite.
It doesn't discriminate, right? Acetaminophen, often prescribed early and often in infancy. Inability to breastfeed. Why would that?
It's golden milk.
Yeah.
There's so many things
We're not getting that very nutritious colostrum that was made perfect for that baby. And this hypersympathetic response that we're going to touch in a little bit.
So a lot of that leads to leaky gut. And so leaky gut, anyone hear of that before?
Yeah.
Yeah? Anyone want to share a little bit more or what you think it is?
Isn't
Leaky
that
gut?
the only condition that actually sounds like what it is?
Yeah, right.
Yeah.
Yeah, so things are happening, the foods you're eating are not being absorbed properly, you're losing nutrients, and there's so much research going on right now, understanding leaky gut and the microbiome, and that gut-brain axis. And so part of our Brain Balance program looks at nutrition because you, again, have to have a comprehensive approach. You can't just look at the symptoms. So leaky gut is one of those components that I would say only relatively recently are people looking at, because I'll admit I have a lot of gut issues and nobody ever used this word until about 10 years ago. And I remember looking into it way back when I was in undergrad just a little bit, but there wasn't a lot of information yet. And in the last 10 years, I've seen article after article come out and people like me talking about, Dr. Kevin talking about it. And now, only I would say the last 5 years, have people who are like, yes, leaky gut, microbiome, gut-brain axis is now confirmed. What's happening, like, it's kind of interesting because we think of the brain a lot controlling everything, but now know what you're eating and the microbiome in your stomach is also controlling what you're doing. And it sounds sci-fi, but it's not. And so the more we learn, the more we can do to support it. And go ahead and take it away.
So that, like she said, the stomach's there to break down the food, give us the proper nutrients, and get rid of what?
Toxins.
Yeah. So when we start to have this leaky gut, what happens, I'm gonna get all scientific, we have these tight junctions inside our stomach, which once we have this decreased microbiome, those tight junctions start to loosen up. And then all that toxins, all the bad stuff our body's supposed to push out now gets into the body. And when we have all this inflammation in the body, what's our body's natural response to do when it senses an invader?
Attack.
Yeah, and what's it create? I said the word. Starts with an I. Inflammation. It causes all this inflammation in the body. Imagine that with breakfast, lunch, dinner, 7 days a week,
Snacks.
365 days a year. It's a lot of inflammation in the body, right? Remember we talked about kids craving the pizza, the carbs, the sugars?
Yeah.
What if I told you it's not the kids craving it, it's the bad bacteria?
Huh.
Because once we deplete that microbiome, that bad bacteria take over, and they want to do what most adults want to do. They want to have little bacteria babies, and they want to reproduce. And once they take over, they act like bullies, and they just take over and over and over, and cause all this inflammation in the body, and all this inflammation in the body starts to get to brain inflammation. Why? Because that sustained inflammation in the body breaks down the blood-brain barrier, which is made up of glucose. So that glucose starts to break down, and we get the inflammation into the brain. Now we're going to see autoimmune reactions, immune hypersensitivity, allergies, brain inflammation, and multiple pathogens.
We see that a lot too. Yeah.
And it leads to leaky brain. Remember I talked about that word disafferentation? How many of you have ever heard of this word, neuroplasticity? Yeah. Who's ever heard of disafferentation?
You haven't?
Have you heard of it?
Heard of neuroplasticity.
Yeah.
That's affirmation.
Disafferentation, easy way to put it, is improper sensory information getting to the brain. Remember I talked about how chiropractors look at the information getting to the brain? How many of you have ever played the game telephone? How often does it ever get around? Now could you imagine if I started here and I said, I want Amanda to get to the word water, would I say blue? Is she ever gonna get water? What if our brain is getting the improper information saying, hey, we need to do this, but I don't know how to do that, so good luck. That's what's happening a lot when these disafferentation takes place. Then neuroplasticity, our brain can be better the next day.
So, kind of recap, a lot starts with the brain, but it also has to do with your spinal cord being able to send that information out properly. But you need those connections in the brain to be strong, and the good news is the brain can change, you can strengthen that, and with proper alignment, that's why literally in school, since you were young, sit up straight, right? You sit up straight, you're aligning your back, and information can be spread appropriately. But when that gets affected, that's when you see these challenges. So what can you do about it is what we want to talk about next. So something that really frustrates me in education and why I didn't go into the classroom is one of the reasons is we're always talking about giving kids choice and whatever they're strong at, let them, if they don't want to write, let them draw, whatever. Sure, to an extent, but if you never work on your weaknesses, that never improves, right? And we're teaching kids a lot of growth mindset these days because you have to fail to literally grow your brain in order to improve, right? Literally, if things are never a challenge, your brain will grow. Those connections never get better. You gotta train it in a specific way to get it to do what you want it to do, right? And so you wanna work on your weaknesses. Again, are you more left brain or right brain weak? Where are you weaker? How do we work on all these components to help that individual out? And I mentioned your senses and your body literally moving is essential for triggering all those pathways in the brain and getting that to be stronger and stronger and stronger. And Dr. Kevin told you in the beginning, this generation is moving 30% less. We're also seeing a lot more challenges than in the past. It's not just because we're better at diagnosing, it's literally they have these challenges too because they're not moving as much. So we talked about how the spine can be misaligned through subluxation, right, through stress and whatnot. But parents always ask me, how does that happen with their brain and development too? A lot of times it's about movement, where your baby's moving around enough, or a lot of times kids with trauma. I see a lot of kids in my program who are adopted who experience trauma. You're seeing these patterns of lack of stimulation, essentially, that prevents the child from developing properly. However, having that said, there's also a lot of research that's still happening to understand why kids who have the perfect upbringing are still having challenges. Something is going on, and perhaps it's an environment, right? We talked about nutrition. Kid nutrition these days with all the processed foods, the sugars, the carbs, that's definitely making an effect on how they're growing up right now and how their brain is functioning. If their body's inflamed, again, their brain is inflamed. If their brain is inflamed, you think those connections are going to be flowing like they're supposed to, right? So that's something we encourage you to work on is stimulate all those senses, literally your sense of smell, your vision, your hearing, your taste, your movement, work on balance. That's a lot of body awareness. A lot of kids cannot balance. Work on activities that cross the midline, cross hemispheric activities basically. Don't just let them use their dominant hand. It's something I work on actually at home is vacuuming. I try to use both hands. I'm not gonna lie. But bilateral movements require both hemispheres of the brain to talk to each other, right? So stepping up those activities, something like a jumping jack is one of our basic tests. When I go do outreach events, I ask kids to do jumping jacks, and you can tell right away if there's a challenge or not. Because two things, either they can't do it, they can't coordinate their body, or they're able to do it, but they can't sustain it. So that's another trick to look for too. Can they balance? Great, but can they balance for a whole minute? Can they balance with their eyes closed, right? Can they balance on an uneven surface? Those are things to look out for, okay? Some of the ways that brain balance that we work on their development, it's based off that pyramid I showed you earlier. Hey, there's Luca. This is her son. So every activity that we do, by the way, they go through over 30 activities in our center in the hour that they're with us. But every activity has multiple levels, and so we meet the child where they're at for each activity. We don't just average it out and like, okay, try this. No, we have to meet them where they're at. That's so essential in education as well. And so working on balance in different areas, working on different senses. You can see the glasses there. They do auditory stimulation as well. Core is a really important part of our program because if you can't hold your body up, if your core is not strong, everything else is gonna collapse, right? It's a natural subluxation, if you will, right? Things are just not holding up. Fine motor skills, gross motor skills, and then even this bottom one is working on a primitive reflex. So if you do have the retained primitive reflex, it's not, again, too bad, so sad. Through training and through supporting the brain to calm down, you can get rid of that, okay? So at home, what can you do? Oh, sorry. So,
Sorry.
no, that's perfect, because I was gonna move on to the next thing. I forgot about this. So our program is not pseudoscience. So we are non-medical, but what we do works. Again, we've worked with so many different kids and working with universities now to support our work. So Harvard released their white paper last year showing how just a portion of the brain balance program, literally moving your body, right, working on rhythm and timing and balance and all those sensory integration, if you will, how it has shown to be just as effective, if not better, than a child who is diagnosed with ADHD, who is on medication, and only if that kid is on the correct medication, which is difficult to find, and on the right dose, which is an experiment as well. So there's a big portion of the population where ADHD medication doesn't even work for them. So, and that's the Band-Aid. What the medication does is these artificial bridges in the brain only as long as that is in their system, right? And that comes with all those side effects, right? Growth and lack of growth sometimes, lack of appetite, sleep issues. And what we do in this natural, holistic way, in a very intentional, personalized way, has shown with the brain scans. And if you look at our website, brainbalancesandiego.com, under research, you can read the whole paper and see the whole brain scans. But it has shown how much better in just 3 to 5 months the brain connectivity is and how much more efficient they are and able to focus. And I see that at my center as well. I would say over half the kids we've served over the last decade plus have had an issue with attention and focus and how much better they are today. Okay? So exercise in general, there's separate studies that show the more your child moves and exercises, just in general, how much better they are at processing the world around them as opposed to someone who's more sedentary. One other thing we did not talk a lot about, but Dr. Kevin mentioned a little bit about that, is mental health. So the brain connections in your, or brain connections in your brain, is not just affecting your motor development and learning, but it affects a lot of mental health. There's a lot of research showing that and confirming that as well, and how when you can improve those connections, you can improve your mental health. For us, I think it's a combination of that, but it's also, you're literally succeeding in all these different areas now and building brand new brain connections and resetting the brain and building new brain connections that help you succeed outside the center as well. And so I call it a positive snowball effect. When you're able to feel like you're essentially keeping up, for kids who are aware that they're not keeping up, they're gonna feel better, right? Today I had a student, if anybody saw us on the news, I think someone earlier said that, on Monday, we were on KUSI, I had a student, Ethan, who was on being featured, and he graduated today, and you should have seen his smile today. He was so proud of himself. But how did he come to the center? Very closed, not confident, really had no aspirations for his career. He had dyslexia and was already at 12 years old wondering, what can I do that doesn't involve any reading? Didn't socialize properly, we talked about that. And through each month, he was only in our program for 4 months, we saw him open up more and socialize more, have better pragmatic skills, and he was beaming today. He was so proud of himself, and he's like going up to you and talking to you. He has a kitty now that he's like, so such a better outcome than if he just continued on dealing with it or someone thinking they'll outgrow it, right? And so mental health, I will attest, every person really that I've come through the program, we see those improvements, not only the quantitative data, but the qualitative data. I would say half the people here are my parents, and you see them just thrive, and that's the goal, right? Help them be able to thrive and not just survive, if they're even surviving, right? So, other things you can work on to improve that brain connectivity and mental health is eat your family meals together and routinely, and eat healthy meals. There's a lot of research that has continuously confirmed when you eat a meal, I believe it's only just even 1 time a week. If you eat a meal together as a family 1 time a week, how much more quote unquote successful they are in the long run. That continues to be the case. But healthy meals that we talked about is key. What you put in your body is so important. Our program, Balance 360, is a low inflammation diet. So some of the most inflammatory foods tend to be gluten and dairy, as well as sugar. It's not to say that your child is sensitive to it, but they may be, so we work you through this essentially low elimination diet, I should say. And then Dr. Kevin will talk to you about a couple of the other things he suggests.
Yeah, and the GAPS diet and specific carb diet. So I'm an expert in take care of the nervous system. I am not an expert in nutrition. But when we put individuals, when we say like we have a lot of challenges at home, we say look at the GAPS diet. Because a lot of times with ABA, not knocking on them whatsoever, they're great at what they do. But if our parents are like, hey, like Johnny's not eating broccoli. Oh, he just wants like candy.
Yeah.
So what do they focus on? Oh, we're gonna try and force Johnny to eat this broccoli. And oftentimes you get more behaviors because of it, because you're forcing this kid to eat something he doesn't want. So with the GAPS diet and specific carb diet, it looks at the low inflammatory foods, and a lot of time it's not introducing new foods, it's supporting the gut with foods the kids already enjoy. The list is actually pretty extensive of what's on there. It's like good for the body. And once you remove the bad stuff that causes inflammation, because remember, inflammation in the stomach gets into the body, gets to the brain, we start to get all these different challenges. And then with my boss's son, Tyler, who we saw earlier, he was put on blueberries and strawberries and bacon for breakfast, lunch, and dinner for 6 months. So that's all the kid would eat. He would not eat anything else because he was craving bean and cheese burritos to the point he would get knives and go after his parents demanding bean and cheese burritos. So we're going to talk about pandas and how we get a lot of the bipolar behaviors into there. That's what was happening. It was always a very aggressive household because his son was craving, well, the bacteria was craving all of this, all the bad food. So once he was put on that diet, the behaviors dropped drastically.
And just so you know, we're not, at Brain Balance, we have licensed, registered dietitians that work with you too. Like, I can support you, but I am not, that's not my expertise. But I know a little bit enough just because I have my own struggles. But it's important, like Dr. Kevin said, to pay attention to what you're putting in your child's body, keep it low inflammatory diet, and work with a professional on that in order to, you know, that's one of the first steps is what are you putting in your body, right? The next thing is limit screen time. So right now that's difficult with a lot of distance learning, but in general that's important. There's a lot of research that shows you want to limit screen time, especially the babies. In the beginning, you really shouldn't have any screen time. How the screen affects the brain, there's still more research, but there's a lot out there showing how it is a negative correlation. It's not to say that technology and screen time is all bad. There's a lot of great educational even apps and programs and tools to support a child's development. But in general, if you can help it, reduce the screen time. What you should be doing is moving that body, right? That's key. And one of the tips that we always share with parents too is if you're going to do screen time, counter it with movement. So if your child wants to watch a half-hour show, well, run around for a half hour before and after, right? Don't just like, okay, sit down, but definitely move your body after screen time and prepare them for success and by playing around and not using toys that think for them, basically. There's so many toys right now that think for you instead of being creative. Early childhood expertise is imaginary play is huge in brain development and socialization as well. So having kids be able to be creative, problem solve, have imaginary play is really, really important. And that all leads you to having adequate sleep. So you can set your body up for success by eating the right meal at dinner. If you're moving your body enough and you're not watching TV, within a couple hours of bed, hopefully you can have a better night's sleep. In a program like ours, generally speaking, kids sleep better because they're working their body out in a good way, feeding it appropriately. Sometimes it's the opposite for a while because their brain literally is building new connections. So it's a little, it's wired, but that doesn't usually last long. But I know Dr. Kevin.
Yep, same thing. Once we're put into that fight or flight response, as soon as we make that adjustment, or we talk that study where it brings us into that parasympathetic response, that's where our resting, healing, and digesting. So a lot of times after an adjustment, an individual sleeps so much better that night. I actually had that with a little boy that just actually started care last week. Came into the office and he was destroying my office, and I mean destroying. I had papers, artwork from kids that were drawn, and he ripped it all off the walls. He was taking dirt from the plants, throwing it on the floor. Everything in his way, he destroyed. We adjusted the boy, and actually after his second adjustment, previously he couldn't sit in the chair. He was 5 seconds, boom, up, running around. Sat down, boom, up, 5. Like, it was just nonstop. He couldn't sit. He sat down in the chair, and Mom noticed he started falling asleep in the office. It happened that fast for this kid. And Mom said every night at bedtime, it was a fight. It was a struggle because he did not want to go to sleep. She came back 2 days later for a follow-up visit, and she said, I got so much done because my son slept for 12 hours. She was able to get so much done because when your kid's running around destroying your house, can you do anything? Yeah. So this boy went into that resting, healing, digesting response so fast. Like I've never seen it that immediate. But I've seen cases where I have kids who have epilepsy, and when I adjust them and I have maybe 2 days after a seizure, you adjust them on the table, they fall asleep because their body needs to rest. So that's where we see that sometimes. I've had kids fall asleep on the table before, and we let them sleep. Don't need to wake them up. Parents are like, "Oh, we're so sorry." I'm like,
No, this
"We're a
is-
kid office. Like, our office is made for kids. Like, let him be. He's fine."
Yeah, so stay there real quick. So essentially what I usually tell parents when they're having struggles, there's 4 things, and I know a lot of pediatricians back me on this, and some of our partners say this. 4 things you should look at before you really need to add other providers into the mix is, what are they eating? Can you improve their nutrition, clean eating, right? Start there. Are they sleeping enough? And by the way, kids with neurodevelopmental disorders, because their brain and their body's working so much harder than someone else, they tend to need more sleep, and they're not always getting it, like Dr. Kevin said. So improve your diet, improve your sleep, exercise. So you need to move that body, right? Get that body engaged and the brain engaged, and reduce screen time. If you can do all 4, generally for, I would say, most of the population, you're gonna see a difference. But the question is, what if you do all those things and it's not enough, right? There's still more going on. That's when an assessment is important. So providers like us will show you a little bit more about what's going on, and there's so many different assessments out there though. That's the problem. If you're interested in learning more about the world, what I call it the wide world of assessments, I have a previous webinar that I did a couple months ago. It's on our YouTube page, so you can check that out. But there's a lot, and parents, just where do I start, right? And the goal question, I would say, I usually ask parents, what is your goal? Because that will guide you in that decision, right? Do you need a diagnosis? Do you want accommodations at school? Do you want to know more about what's happening? And in general, I hope that it's why is this happening? You want to understand the whole picture. And so we're one of the few assessments anywhere that give you a really comprehensive look at the whole child and not just what you're seeing and confirming, like, yep, they have ADHD, like, okay, now what? So we show you exactly what's happening, and from there create a plan of action. And maybe not. I have a lot of families that come to us just to get the assessment so they can get the answer, so they know at least what's happening, and then I can help them with other community referrals or whatnot that's best for that family, right? So getting answers is always the first step, and I always tell parents, don't worry about anything else, just let's find out what's happening first, because maybe you've been through so many providers, or you've been struggling with this issue for their entire lives, and you've never really been told what's going on, right, or what you can do about it. So this is a little bit of what we look at, especially that developmental pyramid. It takes about 1.5 hours, 2 hours for ours, but it's extremely hands-on and fun. We're non-clinical, you're not sitting in front of a computer the whole time, and you learn things that, again, you can't learn anywhere else. So, one other component is, next.
Oh.
The other component of our assessment is not just the physical exercise, but the cognitive side too, because again, that's important to know what's happening, how that's all aligned, and how that improves over time. So we work with Cambridge Brain Sciences, like I mentioned, to understand that a little bit more, and we look at 4 different types of cognition: attention, different types of memory, inhibition, and different types of reasoning. So we get a full look at what's going on.
So like I said, with our assessments, we look at heart rate variability and the thermal scans. And there's also another one we do, it's a surface EMG. We do that more for older kids as their brain's still developing, and the messages that get to the muscles of the back aren't fully developed at this point because they're still going through all the growth process. But we look at heart rate variability, and we're able to see it on scans. I actually get to show you where your nervous system is sitting. And these are actually 2 different individuals that came into my office. They are actually both 19 by some odd chance. But this individual, he actually had a diagnosis of schizophrenia. His mom actually came to one of my talks here at this center, and she sat right there actually, and she brought him in, and when we're doing the scans, we're sitting there. It's a 3-minute test. We have to sit there, and it's also a good indicator for kids, because if they can't sit for 3 minutes, then we're like, hey, you know what, we can't get this test done today. It's okay. We'll get back to it another time. Because a lot of times at the re-eval, kid sits there for 3 minutes, like, because their body's now able to handle that task. But with this kid here, he was sitting there, he's telling me, he's like, yeah, the voices inside my head are telling me to do this. Like, his brain was non-stop. He was talking to himself the entire time. And then actually after I adjusted him, he sat down in a chair to watch his brother get adjusted, and he just sat there. The voices in his head stopped. Remember we're talking about mental health? Schizophrenia is a mental health condition. And he actually, his brain calmed down so much at that moment. He just sat there and just watched his brother. You can see that he didn't have these voices going on in his head. He just had that blank stare because he didn't know what to do with not having those voices. And this individual here, totally didn't explain the scan. This is that sympathetic response. That's that fight or flight response. And this is that parasympathetic, the resting, healing, digesting response. And this is the overall energy in the system. We want to be in this black box in the green region here. That's where we want to be. That white dot's where that kid fell. So his nervous system was very stressed and had very little energy in it. And same with this. So living in that high sympathetic response, that fight or flight response, it's very energy demanding. We start to break down. That's what was happening for this kid. His nervous system started to break down. He actually was in college, getting ready to take finals. He had the diagnosis of autism. And he went to go take finals, had a mental breakdown, lost his cool, flipped out on everyone at the school, went home, flipped out on his parents, and ran away. His 2 other siblings, the second oldest ones, they went, chased him down, they brought him back home, and then he was put on Seroquel. He was put on other medications to say, good luck. Mom came to one of my talks and she gave it to me in the end in tears and said, you're a godsend. Everything you talked about tonight is what my son is going through. We just did a re-exam. We do re-exams after every 14 visits to see how well the nervous system is doing, because if it's not working, why are we doing it? But we're able to show how it works, and actually I wish I would have put his up here because I just did it. He's now up over here. So the energy's increasing, and we're starting to see a lot more interaction. He's talking to me more. When I first asked him, hey Amanda, how are you? It was nothing. I got no response from this kid. I didn't even exist. Remember about the social cues? He had none of those. He didn't know how to interact with me. Now I asked, how's your day? It was good. How are you sleeping? I'm sleeping so much better. He's actually talking to me now. And Mom's seeing this amazing change. And then this is another little boy. He came to our office, and now I'm actually going to show you a thermal scan too. So this was his first visit back in January. So I know the numbers are hard to see here. So the thermal scan, red means bad. So this is 3.3 or 3.6 degrees hotter on one side compared to the other. So when our nervous system is stressed, we can't regulate our own skin temperature. So we do thermal scans to look at that surface temperature of the skin to see how well it's balanced. So we had a lot of heat in his neck. And this was his nervous system scan here, all the way out in the orange. This was back in September, actually. So this one just happened. Now look where his dot is. He's now in where we should be, and a lot of that heat that was here is a lot less. Even though there's still more heat here, Amanda did point that out, and she's like, why is that? I was like, because we changed this, and his body's still adapting, so are we done yet? No, there's still some work that needs to be done.
So it's neat because we both collect data to make sure what we're doing works, right? Like, why would you do something and just hope for the best? We collect a lot of quantitative data because every time they're in center, we're measuring the progress, as well as qualitative data with the parents and the observations that they're seeing to ensure that that score, kind of like his scans, comes down, right? It's less severe or if not resolved. And it's important to continue that conversation, and whatever program you're doing, that they are addressing your needs and not just this general, we're seeing improvement here. And even if you're seeing improvement in center, if you're not seeing improvement outside the center, that's not an effective program either, right? So we're constantly looking at these pieces. You can change it. And Dr. Kimball will talk about some of the success he's seen too, beyond what we talked about.
So this is Fatima. Fatima actually came to our office with a diagnosis of nonverbal autism. So in our office, we actually, I don't want to say I don't care about the diagnosis. We don't focus on the diagnosis of an individual, because once you put that label on them, that's their ceiling.
Right.
But once you remove that label, there's no ceiling, right? So who knows what the potential is for that kid or that individual? Because my office, Center for Health and Human Potential. Let's get all the human potential that we can have. And that's what was happening with Fatima. Fatima came into our office not really speaking. She mumbled all the time, no clarity in her words, didn't have appropriate play with siblings. And then she actually received a very gentle adjustment of her upper neck. She popped up off the table and looked at her parents and said, happy. Her parents lost it. They're like, why did she just say happy?
Where'd that come
What
from?
is going on? And as Kara kept going, she started talking more, and we actually forgot she had this diagnosis of nonverbal autism because she was speaking in full sentences. She was having appropriate play with her siblings. She was having meaningful conversations where now it was one, two, it wasn't just a one, 2 word answers, it was actually a full-on sentence responding to you. And it wasn't until we actually looked on Yelp, mom left us a review saying, my daughter who has nonverbal autism is becoming verbal. She is more focused, less anxious, sleeps better, among many other things. It has only been about a month since we went for her first appointment, and we have seen great changes. Remember I talked about how I work with kids with epilepsy? This is Elliot. Elliot came into our office with a diagnosis of epilepsy, having between 20 to 40 seizures a day. So Elliot, as of October, I think it was 13th, he was officially 1 year seizure free. And what was happening, we had that subluxation of his upper neck. My boss actually did a talk on how chiropractic and misalignments of the cervical cranial junction, so the upper neck, how it's related to epilepsy. He actually just spoke yesterday at the Epilepsy Awareness Foundation. So I can get that video and send it to you guys. You can have a watch at that one. But Elliot, he was doing awesome. And his parents saw the amazing changes with Elliot. They want to get their other son under care too. And I should have left the other picture up here where he's checking his brother. Because we have little toy activators and I tell the kids, take a big breath in, let it out. And then Elliot's birthday was back in May, and mom hears, they missed their appointment because they went camping, and mom hears, take a big breath in, let it out. And she goes out there. Bradley was checking Elliot for subluxations. And I asked Elliot on the next visit, like, who would adjust you better? He said Bradley. I think he was a little biased. But we see amazing things like this in our office because we see what's right with the kid and how we can make it better. And that's what we did for Elliot. Elliot's mom, she was going through her phone one day, deleting old videos, and she was in tears in the office. And I asked her what's going on. She's like, I saw the changes. I'm tearing up now. Woo! She was crying at my office because she saw videos of her son having seizures a year ago, and she's like, my son got his life back. I got my life back. Because you imagine going to bed every night not knowing if your kid's going to have a seizure? That's what they were doing every single day.
So I do want to say too, my assessment we're not medical, so we don't diagnose anything, and what Dr. Kevin and I do is kind of just show you what's going on in a way that it hopefully answers a lot of your questions. And then in our program, we don't claim to cure anything, like I said, but we could try to make the child's life better and really reach their full potential. That's both of our goals, and that's in his, business's name. I'm so glad I have this in here because literally just saw her right before I came here unexpectedly. Michelle, this is the graduate. If you saw pictures of her before that, she never looked at a camera. She's 12 years old, never had a picture, family picture, any picture where she's looking at the camera. Definitely not smiling. She would elope, evacuate classrooms, did not do well in school. Learning was hard, reading was very hard. One of those families where I don't remember the last time they've had a good day. And so full-blown crisis mode is what mom said, and that was the word she used. And they've tried a lot. These are champion parents too, so they've done a lot. And only in about 5 months in our program, we saw her flip and be this whole other child, someone who was all the things I talked about, to being able to smile, enjoy vacation together, take walks together. She learned how to ride a bike for the first time this summer, and I talked to her tonight about, like, are you still biking? She's like, yeah, it's so much fun. Where her older sister, who has also other challenges, who can't do yet, still needs dad's help. Adopted, by the way, had a lot of trauma, a lot of issues, but has all A's in school right now. Never, ever happened. And she just started middle school, and that was a big concern. Like, okay, transitions aren't great. She did better with transitions in our program, but this is a big transition, switching schools, middle school curriculum, everything. No, she's getting A's and she's smiling. She was wearing a dress today with fluffiness. No way would that have happened during even our program here. She wore leggings, it was comfortable, and like a loose shirt or sweater, right? Shoes, no way. They're one of those families who spent thousands probably on shoes, and by partway through the program, she's like, look at my new boots. I was like, oh, okay. And today she's like wearing this fluffy thing with her legs, and I was like, what? Who are you? It was the best thing to see her. I was so happy to see her because she wanted to come by. She missed brain balance, and she wanted to drop off some persimmons. So that's Michelle, and then that's an extreme case though. She had a lot of different challenges, and then sometimes it's more simple where it's a issue of focus, right, and executive functioning. This kiddo here, he is a junior now. He was a sophomore when he was in the program. Was on ADHD medication and literally did not grow for 2 years of his life. So from like 6th grade, 7th grade, he didn't grow at all. And all the pediatricians said, well, he's not losing weight, so whatever, right? Like, it's fine, don't be concerned. But they knew he was not thriving. And as soon as they took him off medication, he shot up, he grew. He's a basketball player and he wanted to, keep up with his friends. So it's a good thing he's was able to catch up a little bit, but they will never know his potential. Like, did it because that was a big developmental year, right? Your middle school year. So after our program, just a few months, he's able to function a lot better now and focus more. He still needs help, of course. Again, it doesn't just go away, but at least he's able to focus. He's able to organize his life a little bit better and have the tools behind it too, because it's not just training the brain. You gotta have the tools behind it as well. And with every child, and even Dr. Kevin, where you see changes and when you see changes, it's gonna differ, right? Sometimes you see things immediately. I always ask parents when I meet with them for the assessment report, how do they do after the assessment? Because sometimes we do see immediate changes. Literally, we weren't even intentionally working on them in a way, but because they're working their brain in such a unique, holistic way, sometimes we hear changes. But things like, in 2 weeks, I just have a family right now. She is a little 6-year-old. I think I never told you, can't play by herself, right? A lot of challenges. In 2 weeks, she's coloring inside instead of these big scribbles. Emotional regulation, not meltdowns every day. She can play by herself for the first time in her entire life. You don't have to be with her. Literally, she could not be 2 minutes alone, right? She's playing by herself. Even sensory, most kids with sensory challenges, the blowers in the bathroom, right? Flushing is too loud. She was at Target, she said the other day, I think this weekend, and mom said she didn't cover her ears. And she asked her, like, hey, you're not covering your ears. And she told mom, I'm getting over my fear. And she was fine. She was doing her own thing and had a glowing review from her after school program, which never happened before. And that's just 2 weeks. And I would say that is unusual. That's a big jump in just 2 weeks. Usually I would hear more common is, oh, they're more emotionally regulated. But it does take time to change, and something I want to set a realistic expectation. We see a lot of different improvements, but remember, these kids have been struggling with these issues pretty much, again, their entire lives. So to expect change to happen like that is not necessarily realistic, but it is possible. Yeah.
And just going off that, like she said, like, it's a process.
Yeah, it's a process.
In my office, like, typically in like a more severe case, so all 3 of those scans that I showed you before, the heart rate variability, all those individuals would be on a care plan where it's more severe, where they're actually seen 2 times a week for the first 4 to 6 months. And then it reduces down to once a week for the remaining rest of the year. And usually at that point, families re-examine, like, hey, you know what, like, Johnny's doing fantastic, we can go to once every other week. So typically we have a lot of people in our practice who've been with us for 5, 6, 7 years because they're now on this wellness path of just maintaining their health.
So ways to stay connected with us for Brain Balance, at least, you can call or text us if you want to learn more, email us. There's a couple books I always recommend, Disconnected Kids and Reconnected Kids, to learn more about brain balance in general, like what I'm talking about disconnection, and activities that you can actually do with your kids, so that might be a good resource for you too, actually. And then on social media, please follow us. We have a lot of resources that we post on there, and then a lot of my previous webinars are all posted on the YouTube page as well. And then our website itself, brainbalancesandio.com, has a lot of blogs and webinars too.
And then how to stay connected with us, you can call or text this number here, or email me. And we also have a community Facebook page. It's a wellness community page where we share a lot of different information on how to help and different research articles out there, because when I do my presentations, all the stuff we have is all factual, it's all research-based, it's all peer-reviewed articles, has all that information for you. And you're actually going to start to receive a series of emails that's going to have that information with you. Even though I didn't do my full talk, it's going to have all the information from my full talk. I'm not going to short you out on the stuff that you didn't get, because all the stuff I talk about in my other presentations a lot more, talking about the numbers and look at the rise of all this stuff and a whole bunch of other things. I would encourage you to come to another one of those talks, because it's a lot of information. Amanda came to it. That's how we actually met.
Yeah.
She came to one of my presentations, and she can tell you it's a lot of information. And yeah, you can connect through here on Facebook, and I just now recently started using Instagram, so I can send you an email with the Instagram stuff. Yeah, I know, right? My boss kind of put that fire into me. So yeah, it's definitely a way to stay connected.
Will this one be on YouTube?
Yes.
No, yeah.
We put it on YouTube.
Okay, sure. Yeah, I was like, we're gonna talk about
Go
it.
back and
But
listen
this is
to it
usually for,
again.
oh yeah, because you gotta share with some of the family.
Yeah.
members. Yeah.
Okay.
Normally we do, but because it's a special in-person, we were debating it. But yeah, we'll put it on
Is
our
your
YouTube page.
channel private?
No,
Oh.
ours is public, but we'll put it on
Ours
the
is private,
screen.
okay, yeah, but yeah, since you came tonight, I can definitely share it with you, I can send it to you in an email, they'll just have it all there for you, and the reason why, cause I actually had a few people who said, oh, it's in person, I don't wanna come.
Yeah.
I get it, I understand, but people, when they show up, they learn so much better.
More engagement, screen time. You're like,
'Cause
oh, I'm gonna
kids-
multitask.
How do you think the kids are doing
Yeah.
with the information through Zoom? It's kinda hard, right? Imagine an adult now having to watch after the kid. We did webinars when everything first started back in March. We did webinars for 3 months. We have people who signed in, and I called over 700 people. Hey, just want to make sure you have access to the video. Oh yeah, I logged in, but I couldn't watch. I had one person out of 700 people who stayed on and watched the entire thing. One person. So the in-person, that's why we have them. And because, I'm sorry, like, families have been in much more, all of you, how many of you are parents? Yeah. You're all here tonight because you have a child who has a challenge, right? You've been in more crisis for these X amount of years compared to what we've been in for the last, 8 months? You've been in crisis so much longer. So that's why we have these events in person. And I know that's why me and Amanda joined to do a presentation in person, because it is so much more information. You retain so much more in this environment. And we've had people who are saying, hey, can you go back to in person because I can't do a webinar. I can't do those things. Because it's not just the kids who can't sit and focus on the TV or the screen, it's the adults too.
Yeah, so we just want to leave it up to you all now. Any questions about what you heard or your own
I'll just
personal
say one
things?
thing really quick.
Yes.
So when I do talks like this, people often ask me like, oh, like what's it look like? So on our very first visit, we do those scans to determine how well that nervous system is doing. And we do a consultation and we do the first spinal check and adjustment on that same day also. Typically, or normally, our initial exam fee is $285, but when I do talks like this, I reduce it down to $150 for an individual and $250 for an entire family unit. Because as we talked about, chiropractic is so much more than just neck pain, back pain, and everyone deserves the opportunity to get checked. And then people also often ask me, oh, do you take insurance? We are not in network with any insurances. What we do though, if your insurance has out-of-network coverage, we supply you with a super bill and you can get reimbursed directly from your insurance company. And the reason why we don't take insurance is because a lot of times the insurance company doesn't really look after your health. Or your health.
We like to say it's what's medically necessary and no longer is your child's best interest in mind. It's just what they're willing to pay for, and that's why we're non-medical. And same thing, we don't work with insurance companies, but I can provide you receipts to, I was talking to a parent today for FSA or HSA.
Yeah, so that's why we do that, and then like I said, in a more severe case, typically families are bringing their child in for 2 times a week for the first 4 to 6 months, and we do re-exams after 14 visits to determine, hey, we're doing well, we can reduce down, because as Amanda also said, some kids are a lot faster, some take a little bit longer, and I never know until we're looking at the scans. So we do re-exams and determine there, like, hey, you know what, Johnny's doing fantastic, we can actually reduce down sooner than we thought, we can adjust the care plan at that. And typically families on a more severe care plan like that are spending anywhere between $250 to $450 a month. So that's just the numbers that I can throw out there for you guys. And then, yeah, so then we'll open up to any other questions you may have. Yeah.
Any patients that have sensory tics or anything like that?
You mean like some
No,
of these?
like picking?
Yeah. I have a few kids in my office that have a lot of esteeming behaviors. I have one little boy when he's upset, he whacks, and I can see the progress he's made because the scar and the scab is actually starting to decrease. He's no longer having as much as that. I had a little boy recently, I did this one. A little boy came in, he actually had a diagnosis of autism. Mom found us through talking about curing autism group, and she actually looked at my website and she's like, you're not on the website. So I wasn't even listed on my own job's website for a long time, so I'm finally on there, thank goodness. But she came in, and then her son, he had a lot of esteeming behavior. He'd have a monster truck,
Over and over, yep.
he'd get stuck. It wouldn't be the car rolls, it was like the car had to flip. After about 2 weeks, seeing him 2 times a week, so those were the cases, it was a lot faster. He started having that appropriate play where the monster truck would actually go across the floor. And we'd have all of that. And then we reduced down to once a week. We started seeing that come back. So that's where, hey, you know what? We need to go a little bit longer.
More aligned, yeah.
So
yeah. And
that's
more
where
left
we
brain week,
increased.
by the way, that repetitiveness is very left brain weak.
Yeah.
How much is each session?
So each session, depending on different care plans, so it ranges either between $52 and $77, depending on the care plan that's selected.
Thank
You're welcome.
So I just want to correct, I said that's not left brain weak, it's left brain strong, it's right brain weak, because the left brain is responsible for repetitive, so it's taking over, right brain can't balance it.
So I listen to podcasts, and so I was listening to an ADHD podcast, and it was a doctor talking about the medication, and he was just so positive about it. So, with your experience, having medication be a part of the plan and the process, I know that each kid is very different, but is that what you're hoping, that it's just no medication, or have you noticed, that medication does play a good part of it, and what's some of your thoughts on that?
I can answer that.
Especially if it's
balance,
optimal dose, right? Like if
Yeah.
you're going through the whole thing and this child has, the parents of this child or whoever has figured out the optimal dose for
Mhm.
this particular individual, and then yet there's still some other things that,
Going on, yeah.
going on,
Yeah.
what do you?
That's a great question. So in the end, it's not about what we want, it's what the parents want.
Okay.
So, and I'm not against medication. We are a non-medical holistic program, but for some individuals, they're gonna require, they're gonna need some type of medication still, because there's still that chemical imbalance and not just the brain imbalance, right?
Right.
Many of our families do come to us though with the goal of either being off medication or never being on it to begin with, or at least reducing it, and I see the whole spectrum.
Yeah.
So Cole, again, went off medication and he's better. Another student this summer, Marco, did a virtual program, or during COVID, I should say, did a virtual program and he's been completely off medication, and that's helpful. One thing I always tell parents though is if you stay on medication, the medication may not be as effective because we're doing what the medication's supposed to do.
Yes.
So you can reduce your amount, which another parent just had a progress report last week with. Yeah, they were able to cut their dose in half.
Yeah.
Yeah, so you're gonna see the spectrum, the whole spectrum. Go ahead.
Yeah, I was just gonna mention, my child does medication, my two, and I try to include them in the conversation,
Mhm.
so they can, be a part of the decision-making for their medication if they feel like they need more, or if they wanna try less. And it's all with the doctor, and I think that's really, the best thing you can do, and giving them options for treatment,
Yeah.
and just keep searching for good opportunities to try different things. Not everything will work, but
Right.
I got to a roadblock and I didn't know what treatment to go to, and that's why I went to Brain Balance. And my daughter was in for 4 months, and we're just taking about a month break, and then we'll probably come back for another month and just check her. But she is still on medication, and I think that she's doing way, way, way better, that I don't know if I need to adjust the medication downward.
Right.
But again, she's on the spectrum, so typically autistic kids need, something to bring down the anxiety
Yeah.
to just get through their day and be able to face challenges.
Yeah.
So you might want to be able to start low and, just build up to where it needs to be. But I think that
Great advice.
even a neuropsychiatrist would say too, the better thing to do is to make sure if you want to go that route for your child, it's better to do that. Otherwise, they end up self-medicating with drugs outside.
Yeah, I get a lot of parents come
So you
in
have
nervous
to
about
be,
that, these behaviors.
Yeah.
I think it's a good thing to look into, and it should. But I do know a lot of parents that just don't want to go that route, and I think it can be, could turn on them if they
Yeah.
don't give their child an option.
Yeah.
So in my office, it's same thing. What's the goal of the parent? If parents want to be off medication, that's their goal. I'm not going to tell them, oh, you need to stop taking this medication. Like, I don't do that. It's more on the parents, like what the parents believe, and then a lot of times we actually do see the same thing where some kids actually can come off the medication because they are able to regulate a lot better. They have a lot more focus, because a lot of times with ADHD, we have all that background noise,
Yeah.
right? But once we remove that background noise, we can sit there and focus. So we don't need the extra help. I even have, because I often get asked, like, do you work with kids? Especially when I work here in the center, I have all the other providers coming to me, hey, do you work with adults? Because
We get asked that a lot.
I'm a pediatric office, but pediatric and family chiropractor. So we get asked that a lot, and I have a 93-year-old woman I take care of in my office. Sweetest lady you'll ever meet. She actually came in, she's like, I've been getting more and more dizzy, like what's going on? Well, she was on her medications, we're like, hey, why don't you just go to your primary, like check your medication. They actually reduced her medication by half because she didn't need as much anymore. She didn't need as much of the medication because she was able to balance a lot more. So it's just more like checking in with the parents. That's where it's like that openness, like, hey, like, so when we do our evaluations, we actually don't talk in front of the kids.
Okay.
Because the kids are always listening.
Yeah,
Even though it
same
may
here.
not seem like they are, they understand everything you're saying. I had a nonverbal girl came into my office 2 weeks ago, and as soon as like her mom was talking about the ticks, she was sitting there flicking the door handle the entire time. I was like, oh, how often does a tick happen? And she looked directly at me, dead in my eyes. She knew exactly what I said. So it's like, that point, I was like, hey, I can't talk about her because she understands everything I'm saying. So a lot of times, like the intake forms, like it's very extensive intake forms where it gives me a lot of information. Like, I had another woman who adopted, son was adopted, and mom was writing out stuff like, oh, possible drug abuse, like in the early on, like all this stuff. And I was like, this mom's openly admitting all this stuff? Like, that's crazy. But then I realized, did mother have any complications? Unknown. And I was like, oh, kid's adopted. Because when I see the paperwork, I don't know if a kid's adopted or not, because a lot of times, some kids don't have the same last name as the parent. So that's what I saw with this kid, and the same thing. It was just like, we don't talk in front of him, but this kid, mom from the beginning was very open about everything that's happened in the process. He said, it's like, oh, he doesn't even call my mom. He says, I forgot what his biological mother's name is. Like, oh, like Susie didn't take care of me properly, so I had to leave. Like, the kid understands, but it's like, I'm not going to talk about that in front of them because it's going to give them anxiety.
Yeah.
It's going to put them more in that stress
Right.
mode. Because as soon as, like, if you're, a lot of times, like, if there's an argument that takes place in the household, what happens to the kid's behavior?
Right.
Goes up, right? Because they sense the stress around them, because they're always listening, and it's just that tone. And kids who have neurodevelopmental disorders are more sensitive to the
Yes.
environment.
Right.
So they sense a lot of like stress from other parents. Like, so when parents are stressed, kids get stressed. That little boy, the one with the 2 scans I showed where he had the different heat, COVID hit, mom freaked out, came in, anxious through the roof. And she's like, his behaviors are so bad. I was like, take a breath, mom. I was like, he's feeding off your energy. Because here in my office, like, we're very calm. Like, I tell parents, it's like, any behavior you experience, I'm trained in it. And don't worry, if something happens,
Exactly.
don't worry, I got it. Like, just, you relax, let me do my thing. Like when the little boy was ripping all the papers off the wall, mom was freaking out, I was like, don't freak out.
Yeah.
I have stuff I can replace. Helping your child is all that matters. He like tipped over something. It's like, Mom, relax.
Doesn't matter right now.
It's okay. Like, it's helping me understand your child more by seeing him do all these things. So then we can say, hey, you know what? Johnny wasn't doing this anymore. That's a win.
Yeah.
So we always look for those wins for kids, right?
Small thing, yeah. Well, I know time is precious. We're just over 8 o'clock right now. Any other questions? And we can always follow up with you after as well.
And I'll stay as long as you need.
Yeah,
I'll answer any questions I have.
Make sure folks can feel
Nowhere to go.
Kind of a long night. Okay. Well, we're each gonna thank you.
Absolutely.
We're each going to follow up with you. In your goodie bags, we do have a $50 assessment if you want to share those with anybody else, or I know you guys are still thinking about it. So Kenny, our center coordinator, will follow up with you. I'm going to be out of the office until the 15th, starting tomorrow morning. So feel free to message me though. You got my contact information, but anyone at the office will get back to you soon. Hopefully we'll catch up soon so you talk to your provider, and have a good night. Thank you so much.
And then, I'm sorry, I forgot to mention this offer I have. I usually make it only good for tonight, because a lot of times parents are like, oh, I gotta check the calendar, I gotta check with the spouse. I'll do it tomorrow. A lot of times, tomorrow never comes. So I only make that offer good for tonight. I'm not expecting a full payment. It's more of just, let's get the information down, let's get you on the schedule, because I have very limited availability because we're very busy. So I have very limited spots. I'm here at this office on Monday, Wednesday, and Fridays. And I have another office in Mission Valley. I don't know if anyone's closer that way. I know I had a few people who were I have another office down there, then I'm there Tuesday, Thursdays, and Saturdays. So we can, at the end, because usually I have a helper, I say go with so and so in the back, but I don't have a helper tonight. So I'll stay here and we can figure out what we can do for you.
Thank you.
Absolutely.
Thank you, have a good night.
I do wanna go.
Okay.
I'm sorry, but just.
Going to the same
Are you?
Say hello to John.
I will. Tell Luca we said hello too. Yeah. But we'll be in touch.
Thank you, Amanda.
Thank you. Good seeing you again.
Yes, I'm gonna go see if my paper printed.
Helpful?
So I'll be back in like
Actually,
20
no, I
seconds.
think that's
I
all.
was wondering if, I mean, I can't afford it right now, but
Yeah.
for Christian, the
Yeah, something to think about.